so you've been recently diagnosed with a VTE?
Yeah.
So do you understand what that means?
No, actually I don't.
Alright, I'll teach it to you. Venous thromboembolism. What is it? It's the third most diagnosed vascular disorder after heart attack and stroke. It is a condition in which blood clots in your extremities, DVT, or can break off and travel to your lungs, a pulmonary embolism. So VTE is an umbrella term that contains a deep vein thrombosis and a pulmonary embolism. A deep vein thrombosis happens in your extremities and a pulmonary embolism is in your lungs. The symptoms of a DVT are pain or tenderness in the calf, swelling in ankle or foot, redness or discoloration or warmth. PE, the symptoms are shortness of breath, chest pain, increased heart rate, and lightheadedness. So this is a healthy vein with the blood flowing through freely. This is a venous thromboembolism. You get blood clots in your veins because of increased clotting factors during pregnancy and also stagnant blood flow during pregnancy due to increased pressure from the fetus. This is an embolus. This can travel to the lungs and result in a pulmonary embolism, which is a life-threatening medical emergency.
Did your doctor explain to you how to give your fragment injection?
No.
Okay, I'm just gonna run and go get some props and then I'll demonstrate for you.
Sure.
For the purpose of this teaching video, we're going to use an insulin needle. The technique will be the same, however, the needle will vary in size. So first you want to start by checking your package to make sure it's not opened, and you want to look on the back to read the medication label and the dosage to make sure it's the same as what was prescribed. Then you want to wash your hands and remove the pre-filled syringe, but leave the protective cap on. It's smart to sit down when you're doing this for the first few times just to make sure you don't faint or become dizzy. Then you want to pick a site with the least amount of swelling, bruising, scarring, and tenderness, as this can decrease the amount of medication absorbed in your bloodstream, and it can also become very uncomfortable when you're poking into a tender area. There's generally 3 sites in which you can give a subcutaneous injection to yourself: your abdomen, your upper outer quadrant of your bum, and the outer aspect of your thigh. If you're going to use your abdomen, you want to be about 5 centimeters away from your belly button and above your hip bones. You should alternate sites daily. Clean the selected injection site with an alcohol swab, cleaning from the center out in a circular motion for about 5 centimeters and wait until dry. Remove the needled cap. Hold it like a pencil with your pointer finger on the plunger, and pinch your skin with your non-dominant hand. You insert the needle at a 90 degrees angle and squeeze the plunger down until you reach the end. Then when you release on yours, the needle will actually is actually spring-loaded and will go into the syringe, and that just prevents needle pokes and things like that. You then want to apply pressure if you have any bleeding, which you really shouldn't because subcutaneous injections normally do not. You dispose of your needle and alcohol swab in a sharps container, and keep your other needles out of reach of children before use. Do not massage or rub the injection site.
Okay, so we just talked to you about how to give yourself a subcutaneous injection. Do you have any questions about that?
No.
Okay, so later on today before your discharge, we will get you to do one yourself and just make sure that, because sometimes when you do it yourself, you come up with more questions.
Sure.
So do you know why you're on a fragment?
I don't.
Okay, so basically it's just what people refer to as a blood thinner. So it stops your blood from clotting because yours is clotting too much. So most people, it would be a bad thing if their blood didn't clot, but for you, because your blood is clotting more than most, we want to decrease that, and you won't get as many clots in your veins, and hopefully you won't get any going to your lungs, because that would be very bad. Do you know, did the doctor go over side effects of the drug?
Nope.
Okay. So I'll just go over some ones that you will notice. And if you experience any of these, it's a really good idea to seek medical attention because it could mean that the concentration of drug that's in your blood is too high, and that can cause some serious issues. So you will bruise a little easier, but if you like bump your arm and it doesn't hurt that much, but you have this massive bruise, that's probably a sign that something isn't right, so you should get that checked out. If you're bleeding a lot, like abnormal, you want to get that checked too. You can get severe headaches, dizziness, rash, and itching, and there is a low risk for osteoporosis. However, it is decreased. It's not as much as the other blood thinners. This is one of the more safer ones. So yeah, if you get bruising, bleeding, severe headaches, dizziness, rash, and itchiness, you want to just get checked out because there might be something. You might need a lower dose or something like that.
Cool. And am I able to breastfeed?
Yes, you are able to breastfeed. A study found that the amount that is transferred between the breast milk is not anything that you need to worry about. So you can.
Cool.
Perfect. Do you have any questions?
Nope. All good.
Okay, we will send you home with a list of these as well because we don't expect you to remember them.
Great.
All right, perfect. Thank